My mic's still good? All right. Thanks everyone for joining us. This is the Epilepsy Foundation of Eastern PA's Transition Workshop Series. This is our final workshop in the series. Our topic today is independence and self-care. Thank you everyone for joining us in person and virtually. My name is Andrew. I'm the Community Outreach Coordinator here at the Foundation. I'm joined by Seamus, our Resource Coordinator for the Greater Philadelphia area, and Rena, who's our Program Director, as well as three wonderful speakers who are going to speak to the topic of independence and self-care today. Before we get started, I want to do a thank you to our sponsor, UCB, whose financial contributions made this entire series and so many of our programs possible. Without further ado, I'm going to introduce our first speaker. Dr. Carinna Scotti-Degnan received her PhD in clinical psychology from Fairleigh Dickinson University in 2014 and completed her postdoctoral fellowship at the Children's Hospital of Pittsburgh, focusing on pediatric psychology. In 2018, Dr. Scotti-Degnan joined the faculty of the Department of Child and Adolescent Psychiatry and Behavioral Sciences at the Children's Hospital of Philadelphia. And in March of this year, she was appointed as an assistant professor of clinical psychiatry at the Perelman School of Medicine and at the University of Pennsylvania. All right.
Introduction. So today I'm going to be talking with you guys about the importance of stress management, highlighting how stress can impact the body, ways to reduce stress, including behavioral coping skills, lifestyle modifications, as well as cognitive coping skills. I'm also going to include some experiential exercises as part of the talk as well, and I invite you to participate as you feel comfortable. So by the end of the talk today, my goal is for you to be able to identify different components of the body's stress response, list those lifestyle modifications that can help reduce stress, as well as learn different behavioral strategies and ways of changing how we think about situations to impact our level of stress. So why is stress management important? We know that living with epilepsy is challenging in general, from the unpredictable nature of seizures to needing to remember to take your medications daily. Additionally, being a teenager and young adult with epilepsy presents its own unique challenges, from feeling maybe a lack of independence as compared to others in your age group, difficulty with transportation, driving restrictions, as well as new socialization challenges when it comes to dating, having colleagues, and friends at a professional level, as well as maybe some restrictions on sports or even determining expectations in the right setting for college and graduate school. Plus, we know that stress in general can be a trigger for seizures, so it's really important to learn healthy, adaptive ways to manage stress. So what does stress do to the body? We know the sympathetic nervous system is involved in regulating heart rate, blood pressure, blood vessel expansion and dilation, sweat production, sleep, as well as alertness. And so when the body enters a period of stress, it goes into this fight or flight mode. And during stress, heart rate and blood pressure increase, sweat production increases, muscles contract, as well as blood vessels, your breathing becomes more shallow. And from an emotional standpoint, you can feel overwhelmed, worried, irritable, and experience even withdrawal from being around others. So you may notice, in addition to those emotional and physical symptoms, changes to your sleep routine, changes to your appetite. And it's really important to pay attention to these cues so that when you start to notice these signs and symptoms, you can employ some of the coping strategies that we'll be going over today. Equally important to recognizing those physical signs of stress is to learn what are your personal stress triggers. So I like to think about stress triggers globally in terms of external and internal stressors. And oftentimes when we think about external stressors, we're thinking about larger issues. But I want to really call attention to those small day-to-day hassles that can build up over time and create a large stress response. So things like physical environment, which can include noise level, bright lights, heat, confined spaces, lack of breaks, social demands. And this can include, perhaps interacting more with others than we're used to. And I know a lot of us have felt that way with the pandemic, kind of going back into work environments, back into school environments, back into social settings. And it's important to note that just being around other people, whether or not those interactions are particularly stressful, can be a stressor. School can be a stressor. So thinking about what kind of assignments you have coming up, tests, applications, as well as life changes. So those big life events like births, deaths, moves, loss of finances, pandemics, and of course, seizures can also be an external stressor. For internal stressors, we want to think about lifestyle choices. So these are things like sleep, hunger, overcrowded schedules, emotional distress. So anxiety, low mood, irritability, sadness, expectations. So whether these expectations are realistic or unrealistic, tendencies towards perfectionism or people pleasing can lead individuals to feel more stress, and mindset. So the presence of having more negative self-talk, pessimism, tendency to overanalyze or ruminate on situations can also increase stress. So to help notice and track your stressors, it's really important to kind of keep a record of them. You can do this kind of more old school style with paper, pencil, journaling. There are also tons of apps that you can look for to kind of write down what stressors you've encountered over the day. And then the goal is over time to start to notice patterns for you so that you can anticipate and then develop a coping plan for when you think you might encounter one of your internal or external stressors. So now I want to move into what are some positive coping skills that we can use when we know that we're feeling stress. And the first section I want to focus on is lifestyle management. And just as a disclaimer, I'm not a nutritionist, but I do think I would be remiss if I didn't talk about the importance of nourishment and using food as fuel as well as water for our bodies. So making sure we're staying hydrated and eating appropriately. Now, what that exactly looks like really depends individual to individual, as well as whether you're following the ketogenic diet for seizure management. So it's really important to direct specific questions about, how much water should I drink or what kind of diet should I be following to your medical team. But this is an important pillar to kind of keep in mind when we think about stress management and healthy lifestyles. In terms of movement, so the CDC, the Center for Disease Control, recommends 60 minutes of daily exercise for teenagers, at least 3 times a week. That 60 minutes should include that heart pumping kind of aerobic exercise. And 3 days a week, it should include more muscle building, strengthening exercise. For adults, the recommendation is 150 minutes and 2 days of that bone building, muscle strengthening exercise. So ways to kind of get motivated is this kind of thinking about incorporating that much movement can feel really overwhelming, especially if we're not used to doing that, is to first start small and build up gradually. So remembering that any kind of movement is better than no movement. Finding something that you love. You're much more likely to stick with a program when you find something that you enjoy doing. And accountability. So this can mean moving your body with a friend or a loved one. It could mean writing down where and when and exactly what you plan on doing to move your body, just to help make sure that you're holding yourself to account for the goals that you set. Sleep. So this is another really important lifestyle management in terms of reducing stress. And you can see on this chart the different ages and recommended hours of sleep that we should get for the Sleep Foundation. But there are also a few tips as well on the right-hand side for how we can get that ideal amount of sleep. As I'm sure many of you are looking at that chart and thinking, probably not hitting where I should be. So a big one is trying to reduce any daytime napping. And I know this can be really common for teenagers and young adults. But I like to think about our sleep debt as a bucket that needs to be filled to the top for us to be able to get to sleep at night. And so there are things we can do during the day to kind of help fill that bucket, like moving our body, waking up early. And then there are things that we can do during the day that can withdraw from the bucket, making it harder to fall asleep or pushing back our bedtime, like napping, like taking in caffeine. So the more you nap, the less likely it is that your body is going to feel tired and build up enough sleep debt to get to bed on time. Another tip is a consistent sleep and rise schedule. So rule of thumb is we do not want to shift our sleep more than 2 hours, either up or back. So if we have a bedtime of 10, that means between 8 and midnight, we kind of want to be consistent within that range, as well as for rise time. And a lot of people think that the time that they go to bed is actually the most important in terms of getting to bed on time, but it's actually the time that you wake up. So if you're more consistent or try to aim to be more consistent with your rise time, that may actually help with your bedtime as well. Another tip is to set up your environment for sleep. So this kind of area of setting up that environment is called sleep hygiene. And there are many things that you can do, but in general, kind of trying to not be on electronics about an hour before bedtime is a great sleep hygiene tip. Keeping the room dark and quiet is also really important. Finding a routine that lets your body know it's time to go to bed is helpful, because it's really hard for us to go from watching television or listening to music or chatting with our friends to getting into bed and, expecting to fall asleep within 10, 20 minutes. And then also reserving the room for sleep. So a lot of times we're doing other things in our bedroom or on our beds, chatting with friends, studying, working on assignments or projects. And then we start to associate our bed with being alert and active and thinking, as opposed to being ready for going to sleep. The last tip I wanted to talk about is this 20-minute rule. This is a really nice rule if you've kind of tried everything else and you're still having a hard time falling asleep. And so the idea is that if you're not asleep within 20 minutes, we actually recommend getting out of bed and doing something relaxing and calming in a quiet area outside of the bed until you feel like you're ready to go back to sleep. And then when you feel like, okay, I'm feeling pretty sleepy, you go back to bed. And if you're asleep within 20 minutes, great. If not, you get back out. And this, again, this idea is that you're then associating your bed with being able to fall asleep within 20 minutes, as opposed to kind of laying there and then all of the unhelpful thoughts and emotions that come with not being able to fall asleep right away. Any questions, Seamus, so far from anyone? Great. Okay. And feel free to, to throw questions in the chat as needed as well. I want to move into some behavioral strategies next. So behavioral activation is this idea that doing certain things affects our mood. And I'm sure that's something that we've all kind of experienced, even in small ways. So for example, listening to sad music may make you feel a little bit lower. Laughing with your friends can make you feel happy, could put a smile on your face. And so this idea that what we do can directly affect our mood comes from cognitive behavioral therapy. And during behavioral activation, we kind of use that connection between our behavior and our mood to plan activities that make us feel better. So the first step, again, is kind of monitoring. So similar to what we do with our stressors is to figure out what are the activities that make us feel good. Some people like to go for walks. Some people like to, chat with a friend. Some people like to color. It all depends on what works for you. And there's no good or bad activity. It's whatever feels right for you. So after monitoring, kind of, okay, these are the things that I know help me to feel better. Then when you start to use them during times of stress, we also want you to check in with how did that make you feel? Did it help the way that we expected it to, or did it not help? And you may find too over time that there are certain things that you like to do for certain stressful situations. So if you're feeling more irritable and frustrated, you may want more physical activity to get some of that energy out of your body. Where if you're feeling maybe more sad or worried, you may want to do a more quiet activity or vice versa. And so oftentimes it's also important to remember that when we're feeling stressed, that's the time we kind of push these positive activities to the wayside to make room for studying a little bit more, working on that assignment or project a little bit more. And those are actually the times that we want to think about protecting these fun, enjoyable activities even more and making space for them. So moving into some different relaxation techniques, and some of these relaxation techniques, there's going to be two of them. The deep breathing is one, where I'm going to invite you and teach you some ways to do this. And so if you're feeling comfortable, when we get to that part, we'll actually be able to practice a little bit. So diaphragmatic breathing, belly breathing, deep breathing, it's referred to a bunch of different ways, is a way to kind of calm down and combat that fight or flight response by slowing our breathing down and also achieving an ideal style of breathing, which is to have a nice smooth inhale, pause at the top of the breath, and then a full and complete exhale. And the idea is to switch from that shallow breathing that's more chest focused breathing into more abdominal breathing. There are many different ways to do this. I'm going to go over two different types with you today. One is 3-3-6 or 4-4-8. And the count just depends on what feels good in your body, so you can play around with it. And the second is box breathing. So for 3-3-6 breathing, what we're going to do is take a breath in for 3 seconds, hold it for 3 seconds, exhale for 6. So I'll lead you in that exercise, and I'll do the counting for you. So if you're ready, try to get into as comfortable a position as you can. You can close your eyes if that's more comfortable for you, or rest them on a boring spot in the room, the floor or the ceiling. You're going to take a deep breath in for 3 through the nose, hold it, and slowly let it go. Breathe in again. Hold. Slowly let it go. Last round, deep breath in. Hold. And let it go. And just notice, check in with your body, how that felt. If you felt like that exhale for 6, you still had a little bit of air left, you didn't fully finish exhaling all of that air through your lungs, you can try the 4-4-8. That may fit better for you. The next type of breathing I'm going to talk about is a box breathing. And so it's called a box because you breathe in for 3 seconds, you pause for 3 seconds, you exhale for 3, and then you pause for 3. So you're kind of making that kind of box shape if you think in your mind. I'm picking 3 seconds, but you can do 4 seconds, you could do 5 seconds, whatever kind of feels good for your body. 3 is a nice entry point just to see what that feels like. So we're going to practice 3 rounds of that type of breathing again. So I'll invite you, as you feel comfortable, get into a nice comfortable position. Again, closing your eyes, resting your eyes on a boring spot in the room. You're going to take a breath in for 3 seconds. Hold. Exhale. Hold. Again, breathe in. Hold. Exhale. Hold. Last one, breath in. Hold. Exhale. Hold. And again, check in with yourself. See, how did you feel after the box breathing versus the 3-3-6? Again, there's no right or wrong way to do deep breathing. It's whatever feels better in your body. Another type of relaxation skill is progressive muscle relaxation. This is a really great one for sleep. And essentially, this works on reducing that muscle contraction that happens during the fight or flight response. What we do is we pair tensing and releasing different muscle groups with diaphragmatic breathing. And we want to make sure that you are just contracting enough to feel a little tension in your muscle so that you can then let the muscle go. We're not kind of tightening so that we're building muscle strength. And we want to make sure that the muscle releases fully. So usually when I'm teaching someone progressive muscle relaxation, what I'll do is teach them to tense and release. So we tighten on the inhale, release on the exhale, and then maybe go through another round of breath to fully make sure that muscle releases. And again, another really good one at night to help with sleep. Most of us, when we're even, in bed, ready to fall asleep, head on the pillow, we still have about 10-15 minutes before we're actually fully asleep. So if you are able to use a relaxation skill at night, it can kind of just help ease the mind, ease the body, and kind of facilitate sleep a little bit easier as well. So relaxation training. So this is where I'll do a little bit of an experiential exercise with you as well, if you're feeling comfortable. Really focuses on sensory information. And the idea is to use the 5 senses to evoke a relaxing image. And by using that sensory information, it feels more realistic. And again, it doesn't really matter what the image is, it's whatever works for you. So to give you a little taste of what imagery can actually do to our bodies and for our bodies, I'll invite you to get as comfortable as you can in your seat. Close your eyes or rest them on a boring spot in the room. Floor or ceiling tends to work really well. And I want you in your mind's eye to imagine a quartered lemon. It's a little lemon segment in great detail. First, focus on the texture of the lemon. Notice all the grooves, the difference between the flesh of the lemon and the peel. And try to imagine the weight of that segment of lemon in your hand. Moving on to noticing the color. Is it a really bright yellow, more pale? Are there any imperfections in your lemon? And thinking about the smell, you can imagine lifting it up to take a smell. And as you continue to imagine lifting the lemon to take the smell, imagine placing the lemon into your mouth, taking a bite out of that segment, feeling all the juice flow in. And open your eyes. Now, how many of you, when you imagined biting the lemon in the room, started to salivate? Yeah, okay, a little bit. That was most of us. None of us had the lemon segment in our hands. And yet, just using our imagination had such a powerful impact on our body in that little minute of imagery that we produced this autonomic response of salivating. And so this is kind of what we can do, but more in a relaxed sense. And in fact, this is kind of the basis for hypnosis. So hypnosis really is kind of thought of too. It's just a deeper state of relaxation. So to do guided imagery, there are tons of scripts that you can follow online. There are apps galore. What you want to focus on is picking an image that works for you. Beaches, landscapes, made up images, does not matter. And then making sure the sensory information's there. Those are the key kind of things that'll work. Autogenics is another type of relaxation skill that uses imagery. This time, though, the imagery is focused on building this warmth and heaviness throughout the body. So images tend to focus on warm water, sunshine, fires, things like that, that actually make us to feel warm, because in our fight or flight response, we tend to lose warmth in extremities, hands and feet. And so the idea is to produce that feeling of warmth throughout the body with particular attention paid to hands and feet. And there are even little handheld thermometers that you can buy to measure your finger temperature to see if it's changed between when you start the imagery and then when you end. And just like guided imagery online, lots of scripts, but these are also all skills that you can learn through working with a therapist as well. Moving into mindfulness training. So we hear a lot about mindfulness. I feel like this has really kind of come into fashion over the past few years. And I'm sure mindfulness gurus will say this is a much too simplified version of what mindfulness is. But we like to think about mindfulness as just being in each moment, experiencing that moment-to-moment living as it is, without judgment about what's happening or striving for something else. It's this relaxed state of awareness where you're really able to both kind of keep in your mind's eye what's happening to you internally, as well as what's going on in the world around you. It can involve both a formal and an informal practice. So formal practices, we take time for a sitting meditation, or maybe we do more mindful movement practices like Qigong, Tai Chi, or yoga. Informal practices is just a way of life in which we're trying to be focused on what's happening as we do different things. So there are tons of articles in the New York Times, for example, that ran during the pandemic about how to, mindfully fold laundry, how to mindfully brush your teeth, all those things that we don't usually pay much attention to. We just go through the motions of. And really the idea is to maintain your attention on what you're doing while allowing all of those thoughts, images, sensations to kind of come in, but not get distracted by them, to kind of keep that attention on what you're doing. You could simply focus on your breath. You could focus on muscles. The difference between this type of relaxation skill and other types of relaxation skills is that you're not changing anything about your breathing. You're maybe just noticing your inhale and exhale, but you're not adhering to the 3-3-6 pattern or the box breathing kind of pattern. A more advanced type of mindfulness skill could be to allow yourself to try to sit and have either no thoughts or very limited thoughts, just allowing them to kind of come and go. And the last kind of relaxation technique before I move into more of the cognitive techniques that I wanted to talk about is biofeedback. And biofeedback itself isn't actually a relaxation training. So it's sort of the analogy we kind of use is like a blood pressure cuff, right? So the blood pressure cuff itself just tells you what your blood pressure is, but doesn't change it. It'll just say, oh, it's high, it's normal, it's low. Same thing with biofeedback. Biofeedback is just equipment that monitors different body functions. So it monitors your heart rate, and they monitor your respiration through a belt. It could monitor your skin temperature through a handheld thermometer. It could monitor muscle tension through sensors that you could put on your forehead or your shoulders. And then what you do is use these relaxation skills, use these mindfulness techniques, use these cognitive strategies to see what effect that has on the body. And the biofeedback therapist kind of helps to then reach a certain target or certain goal with you. So now I want to move into some positive cognitive coping techniques. So the first cognitive strategy I want to talk about is recognizing automatic thoughts. So we were talking a lot about decreasing stress by learning these more lifestyle modifications and behavioral techniques, but we can also decrease stress by changing how we think about a situation. And so the foundation for working on this thinking also comes from cognitive behavioral therapy. And at the core, it's the cognitive triad, or this idea that there is something that happens, we have a thought about this event, and then experience emotion. So an example could be we hear a loud noise outside and we think, oh, someone's trying to get, into our house, and we start to feel really scared. Another way of viewing that situation could be we hear that same loud noise and we think, oh, it's the wind or it's construction going on. And then maybe we feel a little annoyed because we got woken up out of sleep, but then we're able to kind of roll back and go to sleep. With automatic thoughts, they're kind of our first appraisal of a situation. And with that situation, we don't actually know what the truth is until we wake up and investigate kind of what led to that loud noise. And yet we're feeling very differently based on the guesses or assumptions that we're making about a situation. And so what you can learn to do is start to recognize in therapy with working with a provider, kind of what are our automatic thoughts are, what are they saying about the way that we view situations, and are they falling into certain patterns that are unhelpful and may lead to feeling more stressed. And there are lots of different patterns that they could fall into. This is a handful of them, but I'm sure some of us have experienced some of these. Jumping to conclusions is a really big one, where we either kind of predict what's going to happen in the future, as well as self-labeling or more of this catastrophizing. And so when we tend to use these patterns, or our thoughts fit into these patterns, we're probably feeling more stressed than we need to about a situation. And so once we've kind of done the work of identifying that we have automatic thoughts, recognizing that they're falling into these unhelpful patterns, we then start to learn to take a step back and say, okay, what's the likelihood that this is going to happen, and kind of look at the evidence. And there are different questions we can ask ourselves to kind of get at that evidence that you can work with a therapist to go through. We may also scale the severity of the situation, thinking about, is this a really minor inconvenience that maybe I'm thinking about in a more global or heightened way? And then we also ultimately work to kind of help derive a more helpful, balanced thought. So kind of going back to that example of hearing that loud noise late at night, you may have that thought that like, oh, someone's, coming into the house, but then you may say, okay, but I know I locked the door. No one's ever come into our house before. It's been really windy lately. It's probably the wind. And so you can kind of work yourself down from that thought. So why is it important to have positive self-talk? So a lot of people speak to themselves much more harshly than we ever would to people that we care about. And that can come, from a variety of different reasons. A lot of us think that kind of tough love actually helps with motivation and is a good way to kind of get us to our goals. Some of us may not feel like we're, worthy enough beings to talk to ourselves in a kind and respectful manner. And what we know from the research is that when we talk to ourselves in this overly harsh, critical way, it not only increases our stress, but really also lowers our chance of reaching our goals. And so in therapy, you can also work with a provider to learn ways to talk to yourself in a more kind and respectful manner. And one way that I challenge you all to start to think about this and reflect on your own self-talk is to really question that inner voice and to ask, would I speak to someone I cared about, a loved one, a partner, a friend, a colleague, in the way I speak to myself? And if the answer is no, which I suspect for a lot of us, it is no, what are the exact words I would say to them if they were going through a similar situation or stressor? And then try that on yourself and see how that makes you feel. So while I've alluded to the fact that all of these skills can be learned through therapy, it's also important to know exactly when to seek psychological help. And our next speaker, Dr. Riisen, is going to be covering this topic in depth. So I will leave you all in anticipation of her talk and invite any questions if there are any. And if not, thank you so much for your time. Some references for you. And then I'll turn it over to Dr. Riisen.
Pediatric psychologist at Children's Hospital of Philadelphia, and assistant professor of clinical psychology at the Perelman School of Medicine at the University of Pennsylvania. She's a member of the American Epilepsy Society, the American Psychological Association, and the Society of Pediatric Psychology.
Hi, everyone. I just wanted to say thank you for having me today. I'm going to talk a little bit today about seeking support, as Dr. Scotti-Degnan alluded to, and when and how to access behavioral health resources. So after today's talk, I hope that you would come away with a couple objectives here to be able to identify some common behavioral health comorbidities, so behavioral health diagnoses that are common with youth with epilepsy, recognizing signs for when you need support and how to find it, and to talk a little bit about some well-established treatments for anxiety and depression, as these are two of the most common behavioral health issues that we see in youth with epilepsy. So according to CDC, these are just some stats for, in general, what the prevalence of behavioral health diagnoses look like throughout the United States. And then, as you can see below, there's the prevalence rates for youth with epilepsy with behavioral health diagnoses. And there's a little bit of an increase. So if you look at anxiety, according to the CDC, the range for 3 to 17-year-olds is 7.1%, but when we look at youth with epilepsy, anxiety is 16 to 36%, depending on the studies that you look at. Same thing with depression. The rate for the United States is 3.2%, but for depression, it's 23 to 26%. And then these are just some of the other issues that we see that come up: difficulties with behavioral issues, cognitive and executive functioning, and also some issues with adherence. So those are the most common behavioral health issues that we see coming up that we help support our patients with. So while this is at a higher rate, it does not mean you will necessarily develop these things, but it's important to know that you might be at a little bit more of an increased risk. There's also some specific factors based on your epilepsy diagnosis that may also increase risk. For example, how old you might have been when seizures started, how long you've been dealing with them, the number of medications you're on, the seizure types, and some psychosocial factors such as worrying about seizures, perceived stigma, discrimination, or feeling a lack of control or social support. So again, these are just things to keep in mind that you may or may not be struggling with. And then, as Dr. Scotti-Degnan mentioned, being a teenager or young adult with epilepsy, there are some added issues that come to mind around issues with independence that other teens and young adults may or may not be dealing with, whether or not you're able to drive or have to take a break from driving, depending on how well controlled your seizures are. Issues around socialization, like, do I tell my friends? Who needs to know? What do they need to know? Playing sports and physical activity, if you have to take a break from that for a little bit. When you go to college or you move out of the house, things like, who do I tell? And again, who needs to know? And then finding a job. Again, what are the things that I need to share and when do I need to share them? So these can all be additional stressors that teens and young adults might be dealing with. So that brings us to when to find help. And similarly to what Dr. Scotti-Degnan already talked about, I think some things to keep in mind are things that are in different areas of your life. So external stressors that might be coming up, internal stressors or things that you're thinking about, and then behaviors that you or your family members may be noticing. And I think these are important things just to keep in mind, not only for our youth and young adults with epilepsy that we're supporting, but also if you're seeing this in friends, or family members, I think it's just helpful to know these things. So some external environmental stressors that you might want to pay more attention to see if you're having a difficult time coping with are things like school transitions. So going from middle school to high school to college, graduating high school and trying to find a job, academic stress, social issues that may come up, loss, a move, different stressors within a family, work, or other limitations that you might be experiencing related to your medical diagnosis. So say you were seizure free and you were able to drive, but then you had a breakthrough seizure and have to take a break from driving for a little while. The next thing to keep in mind is internal stressors, things that you might be thinking or things that you might be feeling. So if there's a sudden mood change and all of a sudden you're noticing, you know what, I'm more stressed than I have been in the past, or I'm feeling more down than I've been in the past. If there's a change in your medical diagnosis or your treatment, if you're experiencing more negative thoughts, some of those automatic thoughts that Dr. Scotti-Degnan already talked about, and they're happening more frequently and you're having a difficult time coping with them. Or if you're thinking thoughts of, you know, I just don't want to be here anymore, or I don't want to be alive. These are all things to keep in mind, to keep a lookout for that may indicate that you need some support. Behaviors you may see, and these might be things that you notice in yourself, or they might be things that family members may point out to you, because I think sometimes we have a hard time noticing our own behaviors, but may hear this from a friend or somebody else we're close with. So changes in grades or missing school more often, isolating, so going into your room more, not wanting to come out and spend time with family or spending less time with friends, any kind of changes in your appetite or your sleep. People who are crying or more tearful or no longer interested in activities they liked before, that negative self-talk that Dr. Scotti-Degnan mentioned that's happening more often, suicidal statements, from an anxiety standpoint, checking in or reassurance seeking, thinking more of those what if thoughts, and maybe avoiding certain situations or places that trigger stress or cause anxiety for you. Some specific issues that could come up more related to coping with epilepsy that again might give you pause and say, maybe I need some support in this area, or just having a hard time in general coping with your diagnosis. Not sure how to talk to others about your diagnosis or who to speak to. Independence or limitations around independence that you might be struggling with. Having a hard time adhering to whatever the medical recommendations are, whether it be taking your medication, whether it be sticking to the ketogenic diet or different things like that. And then changes with your treatment course over time. So if you're changing medications, if you're having surgery or you're starting the diet, these are all times where you may have a little more difficulty coping and you may need some support. I think the bottom line question that you would want to ask yourself that may help you to think about, am I able to cope with what's happening, given some of those coping resources that Dr. Scotti-Degnan talked about before, or do I need more support than what I have right now? Is how much is this impacting my daily life? If something happens and you are upset and you're able to use some coping strategies, or you're feeling stressed and you're able to use some coping strategies and still move through your day and not change your day, then maybe you're coping well with what's going on. But if you're getting stuck a little bit more or having a hard time and not able to do the things that you used to do or want to do, that would be a clue that it may be time to ask for some support. So if you're seeing that in yourself or for someone else, that's when I think to reach out to get additional help. So who can help? I just wanted to talk about some support services that are out there, because we see all these letters at the end of people's names and we don't often know what they mean. And there's a couple different therapists that you could reach out to for support. So that's this first slide here. The first one up there, and maybe because I'm biased, that's why I put it first, since we're pediatric psychologists, is a licensed professional who specializes in identifying emotional, behavioral, cognitive, and social concerns related to medical problems. So these are the psychologists that are typically embedded in hospitals, who have a lot of expertise in certain medical diagnoses and may be able to help support you with more specific things related to your medical diagnosis. A clinical psychologist, a PhD, or a PsyD is a psychologist, just like a pediatric psychologist, who specializes in treating behavioral, emotional, and social concerns. They can do a lot of the same treatment that a pediatric psychologist does. They just may or may not have that extra experience in a certain medical diagnosis, but you can ask that when you're reaching out and trying to find a provider. A licensed professional counselor, an LPC. So this is a licensed master level professional who, again, is trained in treating behavioral, emotional, and cognitive social concerns. Same as a clinical psychologist. It's just a matter of asking, especially if you want someone who is familiar with epilepsy, whether or not they've seen patients before or treated patients who have seizures or epilepsy. And then a licensed clinical social worker is an LCSW. This is also a master level clinician who, again, same thing, is probably has experience in treating anxiety, depression, or certain things like that. And may or may not have experience working with people with chronic medical illness. So all of these providers may have expertise in certain areas. And that's why it's so important when reaching out and to find someone that you're telling them a little bit about what you're struggling with and asking if they've had experience treating these things before. Some additional staff outside of therapists that could help are psychiatrists. So this is an MD or a DO, and it's a licensed medical doctor who can prescribe medication for behavioral health diagnoses. There's a medical social worker. So these are the social workers that are embedded in the medical institutions where you may seek your medical care. They not only are very knowledgeable about the supports you can get based on your medical diagnosis and things in the community might help, whether related to insurance or things like that, but they can also help you to find resources in the community for behavioral health supports. Some other areas to look that are more general: school. Guidance counselors and school psychologists know your area really well, and they can let you know some providers who might specialize in anxiety or specialize in depression, or just good providers that are in the community that they know and work with that might be helpful. If you're on a college campus, there's college counseling centers. Each center always, usually most centers now, have an outpatient site on campus where they see patients, and they may even have a crisis center too. The only thing to be aware of with this, they may provide short-term or long-term support. Sometimes they only provide 6 sessions a year, but they will also be able to help you find local providers if you need more support than just that adjustment period where you're adjusting to college. And then another really great resource is your pediatrician or your primary care doctor. They can prescribe some of the medications that we'll talk about that might be helpful. And they also can help you find local resources because they're embedded in the community. And then I just wanted to say a quick word, and we'll talk a little bit about how to know the difference between, or when maybe there's more severe symptoms and what the treatment is for that. But if you're in a crisis, for example, if you're having suicidal thoughts or someone is making suicidal statements to you, or your anxiety is so overwhelming that you're having constant panic attacks and you're unable to leave your house or get to certain places, there are more immediate supports you can get. Some outpatient clinics have a wait time. These are things that you can use where you can be seen right away. So of course, there's always the emergency room that you could go to. You want to make sure that the emergency room you go to, though, has the support you might need. So for teenagers, the recommendation would be a emergency room that specializes in working with kids. So like CHOP, St. Chris, different places like that in the area. Mobile crisis is really, really helpful. So this actually might be my first recommendation because you don't need to leave your home to get to an emergency room. These are trained professionals in behavioral health support. There's one for every county in the area, Philadelphia, Montgomery, Delaware, all over. You just can Google mobile crisis team for whatever county you're in. Give them a call. They can either talk you through over the phone how to cope with the situation or the crisis you're in, or they can either come out to your house to support you, or in the pandemic, depending on how, the numbers and things, they've been doing support video over a video chat with you. So this is a really helpful resource. On campus, if you're on a college campus, there's crisis supports there. I included the National Suicide Hotline. I didn't know this, but starting on July 16th, you can actually dial 988 to reach the Suicide National Hotline. So I thought that was really cool. They're trying to make it more across the United States, easier access to that and not have to remember this whole long 1-800 number. They also have a chat option if you go to their website. And when you're in crisis, you're experiencing this amount of distress, there's higher level of cares than outpatient that might be helpful, intensive outpatient, partial programs, different things like that. And so mobile crisis in the emergency room can help direct you to those different support services. So what type of help do you need? I wanted just to talk a little bit about evidence-based treatments, and Dr. Scotti-Degnan already talked a little bit about CBT, and that's one of the major ones I'll focus on because there's a lot of support and how this can be helpful, especially for anxiety and depression. So one of the big studies that we always reference is the CAM study, the Child and Adolescent Anxiety Multimodal Study. It was done in 2010, and it looked specifically at separation anxiety, generalized anxiety disorder, and social phobia across multiple sites. You can see there were a lot of participants ages 7 to 17. And what they found, if you look at the percentages there, that's the percentage of people in each group that showed improvement. So the pill placebo group was 23% showed improvement. The group that was on sertraline or Zoloft, so that's a SSRI, selective serotonin reuptake inhibitor, a medication for anxiety or depression. People who were on that alone showed a 54% increase. CBT alone was a little bit higher at 59%, but you can see the combination of both together, 80% showed an increase or an improvement. So overall, CBT and Zoloft together are most effective in treating moderate to significant anxiety. So when it comes to anxiety, if you're feeling mild anxiety or worries, and a provider can help you figure out where you fall along this continuum, but if there's a small impact on your life and you're struggling a little bit, we recommend CBT alone. For moderate anxiety, we recommend CBT, and after several months of trying that, if that's not effective, then we recommend trying a medication with that. And then for severe anxiety, where it's significantly impacting your day-to-day, you can't leave your house, things like that, we recommend CBT and medication together. A provider in the community, like a psychologist or a therapist, can help you to determine what level you fall on. And then just briefly a little bit about CBT. Again, Dr. Scotti-Degnan talked about it already, but the point of it is to identify somatic symptoms, identify and modify those worried thoughts you might be having, develop some problem-solving strategies to cope instead of resorting to avoidance. And the big piece of this is exposure to that anxiety-provoking stimuli. That may sound like the opposite of what, it's obviously the opposite of what you might want to do, but that's what we know. If you practice this, like for example, a sport like soccer, the more you do it, the easier it gets. If you have a fear of dogs, the slowly you start to expose yourself to that fear, the easier it starts to get. So that exposure is in a small, gradual way to the things that are making you anxious so that you can overcome that fear or worry and no longer avoid it. And then these are just some books I wanted to include for kids and parents, for young kids with anxiety and teens and young adults to help them, as well as parents below. So I'll just leave that up for a second in case anybody is interested or wants to take a picture. And then last, I wanted to talk a little bit just about the treatment for depression. So the TAD study is another big study that we know for treatment of depression. And this was done before the CAM study. So one limitation to this, which CAMS fixed, was there was no placebo group. But what they did was they took, again, a large number of teens, 12 to 17 with depression, and they had a CBT alone group, a fluoxetine alone group, or Prozac, another SSRI, and then a combination group. And what they found here was Prozac alone or in combination with CBT helped to accelerate the improvement of depression in comparison to CBT alone. So sad for us providers, CBT alone did not work, but I think that's important to know, because I think it's important to realize that for significant depression or even moderate depression, medication is really important, that there is, it's not just, what's happening in your life that could be affecting you. It could also be biologically what's happening, and these medications can help. Adding CBT, though, it's important to mention, to Prozac help to minimize and help the patients to cope with suicidal thoughts and events that came up. There was a black box warning for some of these medications that they could trigger some suicidal thinking. If you've been feeling so down and depressed, the thought is if it activates you, those thoughts may come up more. And being in therapy while taking the medication can be helpful, so you can be coping with those side effects or noticing if they're happening and trying a different medication. So similarly to what we discussed with anxiety, for mild depression, we recommend supportive therapy, cognitive behavioral therapy, or something called interpersonal therapy, which they offer for both teens and adults. For moderate depression, we recommend CBT or IBT, and I think it's important to consider medication as well at this point. And then severe depression, we recommend both together. And again, CBT, just the way it's changed a little bit for depression, the way that we support you through that is by helping you to understand situations that cause depressive thoughts or feelings, increasing activity, so that behavior activation that Dr. Scotti-Degnan mentioned before, getting outside, doing more things that you enjoy to help increase those pleasant events, because when we're depressed, we tend to want to isolate and avoid. Identify those negative thoughts or that negative self-talk and try to help reframe them. Those relaxation strategies, improving sleep, and then problem-solving strategies to help cope with conflict. Again, just some books that are really helpful for parents of kids with depression or teens with depression, and then also for teens or young adults who are struggling with depression. The last thing I wanted to mention, because I do think this is a place where people may get stuck, is how to find therapists within the community. A really great website is Psychology Today. It's all over the United States. You go to this website, you can put in the different things you're looking for: anxiety, maybe someone that has experience with coping with chronic medical illness, your insurance, and then your zip code. And it'll tell you the different therapists who are available in your area: psychologists, licensed professional counselors, licensed clinical social workers. So it's a really helpful website to find providers in your area and read their bios and see if you think they're a good fit for you. Another way to do this is to call your insurance company. The only thing with that is I don't know that they can always give you a list of people who specialize in different areas. And so they might just give you a list of people who take your insurance. So then you still have to do the investigative work of trying to find someone. So again, Psychology Today might be the place to go after you have a list of people, type their names in or look them up and see what they specialize in. Again, I can't emphasize enough talking to your pediatrician or primary care doctor, somebody at your school, or a medical social worker, if at your medical institution. They will all have ideas of providers in your area that could be really helpful. And when you're searching for a therapist, some important things to ask them. I think it's important to call a couple people and see if they're taking new patients, how long is their wait. Please don't be discouraged by the wait time. Put your name on the wait list. Sometimes it can come up sooner than you think, but I think it's important, even if you hear it's 3 months, not to give up and put your name on there. Do you accept my insurance? Do you do CBT? Again, CBT I think is kind of like our go-to for either anxiety or depression. So I think that's an important question to ask. And have you had experience treating anxiety, depression, working with people who have epilepsy, whatever the questions are that you think are most relevant to what you're dealing with, the loss of a loved one, grief, depending on what's going on. So that's all for me. If there's any questions, I'm happy to answer. Yeah, so issues with adherence to either the medication recommendations or any other recommendations the medical providers are giving. So that could be things like difficulties with remembering to take your medication. A pediatric psychologist can help you to kind of figure out what are the barriers to remembering and giving you some tips on how to better remember your medications. Some other examples could be like if you're on the ketogenic diet and having a hard time coping with that. And then other general recommendations too that the providers may have of getting a certain amount of sleep, coping with stress and different things like that. But mostly when we talk about adherence, we're talking about medication and taking your medicine and dealing with side effects and things like that. Yeah. Okay. Mm-hmm. That's okay.
As a friend or a caretaker or someone who's in another individual's support system.
Yeah.
But maybe that individual is reluctant to therapy as that caretaker and that support. What kind of things are we looking for? And are there ways to or actually put them in practice?
Yeah, I think what we always say is, you know, you're doing the best you can to cope with everything going on. And here are all the things that you're struggling with right now. And, you know, there are supports that are out there that can help you. This stuff is so hard. Why not go for 1 or 2 sessions? We usually try to recommend 3 or 4, but just go and see how it feels. I think another important thing to mention is the connection is really important. One thing I didn't include is they've done studies, and what turns out to be, yes, CBT is important, but the therapeutic connection and feeling comfortable with the individual is more important than anything else. I think it's important to say, just try it out and see how it feels. And if that doesn't feel like a good connection with that provider, we can look for other people. It might be helpful if you know of people within your circle who have done therapy and had a good experience to talk to that person about it. We recommend that a lot. Like, you know, I've had kiddos who, you know, have a hard time with like an ADHD diagnosis, but there's someone else in the family who has it and may be taking medication or have done therapy, and that's helpful. So I think just being able to connect them with somebody else who's had a good experience, encouraging them like anything else to try it out. And if they're not comfortable, try a different provider to involve them in the process. Psychology Today, again, is great. You can see their picture, you can see where they're located, to make sure you find a female provider or male, depending on what they're most comfortable with. Those are kind of my tips to try to encourage someone to get involved. Do you have any other thoughts, Dr. Scotti-Degnan? Yeah.
No, I think those are really good tips. Also, just like debunking what therapy is. We still think it is just like sitting there and like talking about our and like, well, what is talking for you? And so especially for teens and shows, emphasizing the more active roles and like never strategy. Honestly, I'm sure if we had our druthers, it'd be taught first grade curriculum. And to be honest, schools are doing a lot of this now with the pandemic. And so also pointing out, like, if the individual that you are kind of in their circle with have had exposure, hey, remember that class where you did those like really fun things? Well, this is exactly what you would do. So I think it's more active. And get therapy yourself as a care, because just coping with kind of a loved one is super stressful, and especially if they're not willing to get help, and kind of watching that situation evolve and kind of knowing that it may get worse before it gets better, and so making sure you're buffering up your own symptoms.
Mm-hmm.
All right, again, big thank you to our first two speakers, Dr. Riisen and Dr. Scotti-Degnan. At this time, we're going to take a short break for lunch. For those joining us here in the room, lunch will be set up in the back in just a moment. For everyone at home, we'll see you in a little bit. And you may have noticed in the chat, we invited everyone at home to take a selfie in front of your computer with wherever your setup is, so we can see you enjoying the workshop from home as well. There's a link in the chat to upload those selfies if that's something you're comfortable with, and we hope to see you. And we'll be back here at 12:45 after our lunch break. Thanks, everyone.